So I just discovered literally that people don't know that babies should not given water. Babies at the age of 6 months should not be given water. So in this video, I'm going to tell you why you shouldn't give your baby water at the age of 6 months, because the baby can literally die. And we're going to also be talking about reasons why babies die suddenly. That this is called sudden infant death syndrome. You just wake up and you notice that your baby is gone. Not you, but I mean, so the baby is healthy, everything is okay, but why do babies die? So these are the things we'll be talking about on this page. If this is your first time here, please subscribe and turn on your notification button so that when I make videos, you will hear it. You will see it. My name is Nurse Merit. I'm a nephrology nurse. Basically, dialysis kidney is my specialty. If you have questions in regards to them, put them in the comments section. Okay, now let's get to it. Why should you not give your baby water? Baby that is under the age of 6 months, and what will happen when you do so? Now, a baby that is less than 6 months should not be given water because their kidneys are underdeveloped. Okay, so because the kidney is underdeveloped, this means that the kidney cannot handle water at this time. And you know what the kidney does? It filters water out, excess water out. You know, it does a lot of jobs. So if you want to know about the kidneys, I'll put it on the description box. So now because it's the baby's kidney is not matured enough, when that baby drinks water, the water goes and stays in the bloodstream. Now it begins to dilute the sodium on the bloodstream. Okay, it now makes the blood not blood. It makes it like, you know, less thicker, like it dilutes the content, especially the sodium on the bloodstream. This will result to a condition known as hyponatremia or water intoxication. It can also happen in adults when an adult takes a lot of water that he should not take. Okay, but in adults own is easy because even if the adult takes a lot of water, the kidney is matured enough to, you know, keep on the turnover, you know, making the person pee the excess out. However, a baby's kidney cannot handle this. Now you'll be wondering, is it not just a little water? Yes, it's a little water, but the kidney is not developed yet. So this can cause hyponatremia or water intoxication, and this hyponatremia can cause arrhythmia on the heart. It can cause seizures. It can cause even the baby to slip into coma. It can cause brain damages. It can even cause death. So this is a serious thing. Don't give your baby water when they are less than 6 months of age. Okay, I know the question now will be, when will my baby start taking water? We'll talk about that. Now, the second thing that can happen is malnutrition. That baby will be malnourished. A baby that is always giving water will be malnourished, because the baby's stomach is like the size of an egg. Okay, so because of this, it has a small capacity to, you know, take on food. So when the baby drinks water, it takes the whole space of the baby, so the baby can no longer eat because the baby is filled up. So when you give the baby food, the baby can't eat the breast milk. The baby can't take the breast milk. The baby is just filled up because the space of the stomach is very small. So this will continuously make this baby malnourished. Okay, so I know your next question is, so how will my baby get water? Your baby gets water from the breast milk and from the milk formula you're giving to him or her. The breast milk contains about 85% of water, just water. The formula contains about 86 to 87% of water. So you see, your baby is already having water, and the breast milk, your baby needs those nutrition that comes from the breast milk and the milk formula, because they are so nutritious. They have a lot of vitamins, they have a lot of minerals, they have all the nutrients that a baby should have is contained in those formula, in the breast milk and the formula that you're giving to your baby. So when you allow the water take in place of the baby's milk, of the baby's food, the baby is filled. He himself thinks he's full, but he's not getting the nutrient that he's supposed to get, and this can cause a lot of deficiencies in that baby. Failure to thrive, the baby won't grow well. Some organs and some brain organs that are supposed to mature won't get enough nutrients. Baby can have malaisma and so many things that the baby can develop. Now, having known about this, when would you start giving your baby water? It's recommended that you start giving your baby water at the age of after 6 months. You let your doctor know. If your doctor will not tell you to start incorporating water little by little, just gradually. You don't just start giving the baby water like that. So 6 months to 1, some people, your doctor will tell you 1 year. It all depends. Now, why do babies die suddenly? This is called sudden infant death syndrome. Okay, this has become rampant. Okay, number one, it is not known. Number one cause is that it's not known. It just happens, but there are things that can, risk factors that can precipitate this from happening. So you should, it's important that you know this, and then you prevent it. Number one is when you're pregnant, it's very important that you should not smoke. So people that smoke during pregnancy or are exposed to smoke, that you go to club and you inhale all of the smoke, you are at risk of giving a baby birth to a baby that will have some deficiencies, and probably the lung may not develop much, or they can have surfactant issue, or just some issues in utero, and then when it's being given birth, they can die. Number two reason, so it's very important. I'm giving you the cause of this. I'm also giving you what to do to avoid it. So don't smoke when you're pregnant. Don't take alcohol when you're pregnant. This can also increase that risk. Okay. The next thing that can cause this is the lying a baby with the face like this. Okay, a baby shouldn't face their stomach down. Okay, babies should not face their stomach down. A baby is supposed to lie on their face up this way. Okay, like this. A baby shouldn't face down. A baby shouldn't lie sideways. No, this is because if a baby lies facing this way or sideways, if the baby lies face with their stomach, the baby can get their nose stuffed up in the pillow or the bed or the clothes or something and choke without you knowing. A baby lying sideways, the baby can easily roll. The baby can easily roll on the bed, roll and then face the bed. Okay, so the baby is lying down sideways, and then from sleeping, the baby can just roll and face the stomach down, and the baby can suffocate. So please, the best way for lying down your baby is face the baby up. That's how it is the correct way of lying your baby, so they don't develop sudden infant death syndrome. The next thing is that you shouldn't share the same bed with your husband and with your baby. Babies should have their own cots, okay? And their cots, baby's cots should be firm. It shouldn't be soft like you can fold, okay? Another one is that you should not, lying down with your baby can, make this happen, because you can, in the middle of the night, your baby can come close to you, or you can come close to your baby, and then anything can happen. So this thing can happen, and your baby can, during the night, suffocate. The next thing that can predispose babies to die suddenly is if you're sleeping with your partner that is smoking, or if your husband smokes. Your husband should not be in the same room with that baby. A smoking partner can increase a baby to die suddenly because of the residues of the smoke, even coming from his clothes, from his breath. A baby shouldn't inhale anything smoke. Please, if your partner smoke, I don't know if they should get a room or something. I don't know how you're doing it, but it's better you know that this can predispose a baby to sudden infant death syndrome. Smoke should not come anywhere near a newborn baby. Now, the next thing that can cause this is giving birth to premature baby. Okay, some babies that are giving birth prematurely, all care should be taken when you are nursing these babies. You don't just leave them alone in a room. And please, at the first 6 months of your baby, okay, make sure you share the same room with your baby. Your baby's cot bed is with you. You share the same cot with you share the same room with them, so that you can check up on them and monitor them. If you're sleeping with your baby, if you must sleep with your baby, make sure there are no extra blankets, extra bed sheet or pillows that this baby can cover themselves with. And make sure you don't smoke, you don't drink, and your partner do not share the same room with you if they smoke and they drink. Now, if you're covering your baby, tuck your baby in from the waist. Don't anything that will cover the baby from the shoulder, please avoid it. The whatever the baby's cover should cover and tucked in. The baby's bed sheet should be tucked in neatly and tightly. Remove your baby's cap. Don't wear your baby cap when they are sleeping, because the cap can fall off. Okay, don't make the room too cold or too hot for the baby, and don't overfeed your babies. Remember, babies should not take water less than 6 months except your doctor says otherwise. Okay, basically that's it. So I'll be putting videos on how to conceive easily, some women's video, all those questions you've been asking me, ovulation and all. We'll be putting it on the comment section. If you have any questions, just put them in the comment section. If you want to have a consultation with me, I'm going to make my number available on the description box. So like this video, share and follow for more. Have a nice day.